What if one of the most highly praised health trends in modern nutrition is silently undermining the health of the very people who need protection the most? Every day, millions of older adults tune into health channels, read wellness blogs, and listen to experts who call extra virgin olive oil a miracle in a bottle. They are told to take a tablespoon of this liquid gold right before bed to heal their joints, clear their arteries, and protect their brains. But if you are managing type 2 diabetes, struggling with high blood pressure, or deeply worried about cognitive decline and dementia, this seemingly innocent nighttime ritual could be a hidden trap. What most well-meaning health advocates fail to realize is that the human body operates on a strict biological clock, and introducing a heavy dose of pure fat right before you sleep completely alters your overnight physiology. When you consume extra virgin olive oil at the wrong time, your body is forced to redirect its limited nighttime energy away from deep healing and into complex digestion. Tonight, we are going to pull back the curtain on the physiological mechanisms that standard health advice completely ignores. I am Dr. Harold Meyers, and over my decades of clinical practice, I have seen how blanket health recommendations can backfire when applied to complex aging metabolic systems. We are going to explore exactly why drinking olive oil at night poses a silent threat to your blood sugar stability, your early morning blood pressure surges, and your brain's overnight self-cleaning cycle. By understanding the deep science of how your organs function during sleep, you will learn how to protect yourself from these hidden dangers and make truly informed decisions for your longevity. To understand why this nighttime habit can be so disruptive, we first need to look at what happens inside your bloodstream when you are living with insulin resistance or type 2 diabetes. The internet is full of articles claiming that olive oil stabilizes blood sugar because it slows down gastric emptying, meaning it delays the speed at which food leaves your stomach. While this is true and highly beneficial during a daytime meal, it becomes a major problem when you are sleeping. In a healthy metabolic system, blood sugar remains relatively stable throughout the night. However, for those over the age of 50 who struggle with insulin sensitivity, the body faces a natural phenomenon known as the dawn phenomenon. Between the hours of 4 in the morning and 8 in the morning, your liver naturally releases stored glucose into your bloodstream to give you the energy to wake up. When you drink a tablespoon of olive oil right before bed, you introduce an influx of concentrated fatty acids into your system at the exact same time your liver is preparing for this glucose release. High levels of free fatty acids in the blood directly interfere with insulin signaling inside your muscle and liver cells. Instead of helping, the fat creates a temporary wall of resistance, making it even harder for your insulin to clear the glucose from your blood. This causes an aggressive, hidden spike in your blood sugar levels in the early morning hours, a spike that happens while you are completely unconscious. Over time, these consistent nighttime glucose surges contribute to microvascular damage, nerve stiffness, and accelerated metabolic exhaustion. Let us look at how this impacts your cardiovascular system, specifically your blood pressure. For decades, patients have been told that the oleic acid in olive oil reduces bad cholesterol oxidation and keeps blood vessels flexible. While the long-term inclusion of olive oil in a Mediterranean diet is undoubtedly heart-healthy, consuming it as a concentrated shot before sleep introduces an immediate physical challenge to your circulatory system. The most dangerous window of time for anyone with hypertension is not during a stressful workday or an intense workout. Statistically, the vast majority of severe cardiovascular events, including heart attacks and strokes, occur between 3 in the morning and 6 in the morning. This is because your blood pressure naturally undergoes a sharp surge right before you wake up, and your arterial walls experience their highest level of stiffness during these early hours. When you ingest a dense tablespoon of oil 30 minutes before sleep, your body cannot simply ignore it. Your digestive tract must work exceptionally hard to break down, emulsify, and absorb that fat. To do this, your body must redirect a significant volume of blood flow away from your brain and your extremities, channeling it directly into your gastric arteries. This shifts your systemic hemodynamics at the exact moment your cardiovascular system is supposed to be resting and dipping into a lower protective blood pressure state. Instead of allowing your heart rate to slow down and your arteries to relax, your heart is forced to pump harder against altered blood viscosity to maintain circulation to both your hard-working digestive organs and your vital systems. For an individual in their 60s or 70s who already possesses hardened or narrow arteries, this unnecessary overnight cardiac workload can elevate the very risks you are trying to prevent. The impact on the brain is perhaps the most concerning piece of this puzzle, particularly for anyone facing the reality of cognitive decline, memory slips, or a family history of Alzheimer's disease and dementia. In recent years, neuroscientists have made a monumental discovery regarding how the brain maintains its health as we age. It centers around a system known as the glymphatic system, which is essentially your brain's overnight waste management and self-cleaning mechanism. During the day, your active brain cells produce metabolic waste products, including a highly toxic protein called beta amyloid. If this protein is allowed to build up, it forms the characteristic plaques associated with permanent cognitive decline. The glymphatic system only turns on when you enter deep, slow-wave sleep. When this happens, your brain cells physically shrink by up to 60%, allowing cerebral spinal fluid to rush through the tissue like an internal wash cycle, flushing the beta amyloid out into your lymphatic system to be cleared by the liver. However, this complex neural cleansing process requires an enormous amount of metabolic energy. Your body operates on a zero-sum energy budget during the night. If your metabolism is heavily taxed by the intensive process of digesting and processing a concentrated bolus of high-calorie fat in your stomach and intestines, your systemic resources are compromised. The body prioritizes active digestion over cellular cleanup. As a result, the glymphatic system cannot achieve its full, deep wash cycle. By trying to deliver protective polyphenols to your brain at bedtime, you may inadvertently be stalling the very mechanical cleaning process that keeps your memory intact. Consider the story of a patient I treated named Arthur, a 68-year-old retired accountant who came to my office after noticing a worrying trend in his health metrics. Arthur was managing mild type 2 diabetes and took medication for high blood pressure. He was highly disciplined and had read an online article written by a popular wellness guru advocating for a nightly tablespoon of extra virgin olive oil to improve longevity and protect against memory loss. Arthur followed this advice religiously for 6 months, believing he was giving his body the ultimate advantage. However, when we reviewed his continuous glucose monitor data, we noticed a recurring, unexplainable spike in his blood sugar that began around 4:30 in the morning and lasted until he ate breakfast. Furthermore, his morning blood pressure readings were consistently higher than his evening readings, despite his medications. When Arthur mentioned his nightly olive oil routine, the pieces of the physiological puzzle immediately clicked into place. His body was fighting against the fat processing all night long, inducing localized insulin resistance and preventing his cardiovascular system from entering its natural nocturnal dip. I advised Arthur to stop taking the oil at night and instead move that same tablespoon to his afternoon meal, drizzled over a fresh plate of vegetables. Within just 3 weeks, his early morning blood sugar spikes flattened out completely, his morning blood pressure returned to a stable baseline, and he reported feeling significantly less groggy upon waking. Arthur did not need to eliminate olive oil from his life. He simply needed to stop forcing his body to process it during his critical hours of sleep. Another hidden danger of this practice relates directly to the health of your digestive tract and your gut microbiome. We often hear that olive oil acts as a powerful prebiotic, feeding beneficial bacteria like lactobacillus and bifidobacterium in the large intestine. While this is scientifically accurate, the timing of when these compounds arrive in your gut changes everything. During the night, your digestive system relies on a specific sequence of wave-like muscular contractions called the migrating motor complex. This system acts as an internal broom, sweeping undigested food particles, cellular debris, and excess bacteria out of the small intestine and into the colon. This sweeping motion prevents a highly uncomfortable condition known as small intestinal bacterial overgrowth, which causes severe bloating, gas, and poor nutrient absorption in older adults. The migrating motor complex can only function when you are in a completely fasted state. If there is active food or concentrated fat sitting in your upper digestive tract, the internal broom is immediately turned off. Drinking olive oil before bed halts this natural cleansing cycle for hours. Instead of a clean, rested digestive system, the fat sits stagnant in the stomach and upper intestine, slowing down gastric motility and predisposing vulnerable individuals to nighttime acid reflux and heartburn. When you lay flat or even on your side with a stomach full of slowly digesting oil, the lower esophageal sphincter relaxes, allowing acidic contents to creep up into the esophagus, disrupting sleep continuity and causing chronic throat irritation. Furthermore, we must address the widespread issue of muscle preservation and sarcopenia, which is the progressive loss of muscle mass and strength that occurs naturally as we age. Many wellness influencers suggest pairing nightly olive oil with a slow-digesting protein like cottage cheese or Greek yogurt to combat this muscle loss. The theory is that the fat will slow down the absorption of the protein, providing a steady stream of amino acids to your muscles while you sleep. However, this approach completely misunderstands the phenomenon of anabolic resistance in older adults. As we cross into our 60s and 70s, our muscles become less responsive to regular protein signals. To trigger muscle protein synthesis effectively, an older adult needs a rapid, robust spike of amino acids in the bloodstream, particularly an amino acid called leucine. When you coat that protein in a heavy layer of olive oil fat right before bed, you slow the digestion down to such a slow crawl that the necessary amino acid spike never reaches the threshold required to signal muscle repair. Your muscles hear a faint whisper instead of a clear command. Instead of building muscle, you are simply adding extra calories and fat processing to your liver during the night while your muscles remain in a stagnant state. To achieve true longevity and health optimization, we must learn to work with our biology rather than fighting against it with trendy, short-sighted protocols. Extra virgin olive oil is indeed a magnificent food, rich in compounds like oleocanthal, hydroxytyrosol, and oleuropein, which possess profound anti-inflammatory and cellular protective properties. But the true magic of olive oil is unlocked when it is consumed during your active waking hours. When you eat olive oil during lunch or an early dinner, your metabolic rate is at its peak. Your circulation is fully capable of handling nutrient distribution, and the physical movement of your day assists in lipid clearance. This allows your liver to process the monounsaturated fats cleanly, helps your blood vessels absorb the antioxidants without disrupting your sleep hemodynamics, and ensures that by the time your head hits the pillow, your digestive system is completely empty and at rest. This empty state is the exact signal your brain needs to initiate the glymphatic wash cycle, the exact environment your cardiovascular system needs to safely lower your blood pressure, and the precise state your liver needs to balance your blood sugar levels before the morning dawn phenomenon arrives. If you want to protect your health as you age, the most effective protocol is simple, affordable, and deeply grounded in circadian science. Keep your extra virgin olive oil in your kitchen, but use it with intention during the day. Ensure you are purchasing high-quality oil that comes in a dark glass bottle to protect the fragile polyphenols from light damage, and look for that characteristic peppery bite at the back of your throat, which proves the presence of active anti-inflammatory compounds. Drizzle it over your daytime meals, mix it into your salads, or use it to coat your steamed vegetables. But when the evening arrives, let your body enter its natural state of rest. Stop the nighttime shots, put away the supplements before bed, and give your organs the peace they require to perform their natural evolutionary repair processes. Your independence, your memory, your cardiovascular strength, and your metabolic health are not determined by quick fixes or internet miracles. They are built on a foundation of respecting your body's internal clock and providing the right nutrients at the exact right time.